Hey, it's Dr. Nuesse here again, and today I want to answer the question, I'm dieting, I'm losing weight, why is my hemoglobin A1C actually going up? That's coming up next. Okay, so what prompted me to actually make this video today is concerns brought up by two of my patients recently. It just happens that they both had a very similar concern, and it was that they went in, got their hemoglobin A1C taken, and was actually elevated from their last visit, even though they were significantly lower in their weight and they were losing weight. So why is that? Why did their hemoglobin A1C actually go up? And so the reason that I typically give patients when they ask this question or have this concern is that unfortunately there is a limitation to the hemoglobin A1C test. All right, so let's talk about specifically what the hemoglobin A1C test is. So the hemoglobin A1C test actually measures the percentage, so it's a percentage, the percentage of your hemoglobin that is glycolated or that has sugar attached to it. So the ranges are anything above a 5.7% would be considered pre-diabetes. Anything over a 6.5, you would be diagnosed with having diabetes. Now that can be reversed if your hemoglobin A1C then gets lower. So the issue here is that this is a very simple blood test to do, and hemoglobin A1C test is very easy to detect, but the issue is that once a hemoglobin molecule gets glycolated, once it has sugar attached to it, that hemoglobin molecule stays that way. That sugar doesn't then come off. And this sugar on the hemoglobin can actually last for up to 3 months. So typically this would be the pattern that I would see, is that a patient would be concerned and they'll bring me their blood test and they'll say, my hemoglobin A1C has gone up and I've been losing weight. What's going on? And I will tell them that most likely what's going on is you just haven't been doing the program for long enough, or haven't been losing weight for long enough. People will come in after doing this for like 3 weeks or a month or even 6 weeks. So what the hemoglobin A1C test is giving you is an average over 3 months. If you've gotten your blood work done maybe 4 or 5 or 6 weeks into starting to lose weight, you're going to be counting then 6 weeks then back. And typically what happens when people start to try to lose weight is they really kind of let themselves indulge right up to the point where they do start losing weight. So most likely what happens is before you actually started losing weight, you were raising your hemoglobin A1C, and then you started to lose weight and it's probably coming back down, but because we've got that 3-month average, you're not actually seeing the results quite yet. That being said, if you're losing weight, if you're dieting, if you're eating healthy and you're losing weight and it's been several months and your hemoglobin A1C is still high or still elevating, this is certainly something you're going to be wanting to talk to your doctor about because that is completely unnatural to what happens typically when you lose weight. Again, if you're concerned about your A1C levels or your tests, no matter what time frame is that you've been trying to lose weight or eat healthy, you should always be speaking with your doctor as well. All right, so a little disclaimer there. So I hope that helped clear up some of the misconceptions here on hemoglobin A1C. And until next time, stay happy and stay healthy, and I'll catch everyone in the next video.